Are you changing your pad or tampon much more often than you think you should? Maybe you're passing large clots, bleeding through your clothes, or your period seems to go on forever. You might have heavy menstrual bleeding, and while some people have naturally heavier periods than others, very heavy bleeding shouldn't simply be accepted as normal. From fibroid and hormonal problems to adenomyosis, medications, and bleeding disorders, let's talk about what could actually be causing it. You don't need to measure your menstrual blood in a laboratory to know that something isn't right. Every menstrual bleeding is bleeding that significantly affects your physical, social, or everyday quality of life. You might need to change menstrual products very frequently, use 2 forms of protection together, wake during night to change them, bleeding through your clothes or beddings, pass large clots, or bleed for more than a week. The impact on your life matters. One common explanation is uterine fibroid. Fibroids are non-cancerous growths arising from the muscle of the uterus, depending on their size and location. Particularly when they affect the uterine cavity, they can contribute to heavy or prolonged menstrual bleeding. Some people also experience pelvic pressure, pain, abdominal fullness, or urinary symptoms. But many people with fibroids have no symptoms at all. If your periods are both heavy and particularly painful, adenomyosis is another possibility. Adenomyosis occurs when tissue similar to the lining of the uterus is found within the muscular wall of the uterus. It can cause heavy menstrual bleeding, painful periods, and pelvic discomfort. Symptoms can overlap and with other gynecological conditions, so you can't diagnose adenomyosis based on symptoms alone. Sometimes, the problem isn't a structural abnormality at all. If ovulation doesn't occur regularly, the lining of the uterus can build up differently and bleeding may become irregular or heavy. This can occur with conditions like PCOS and thyroid disorders, and irregular cycles are also more common around the early reproductive years and during perimenopause. That's why your menstrual pattern can provide important clues. Here's one cause people often don't think about: a bleeding disorder. If your period has been extremely heavy since they first began, especially if you also bruise easily, have frequent nosebleeds, bleed excessively after dental procedures, or have relatives with similar problems, tell your doctor. Certain medications, particularly anticoagulants, can also increase menstrual bleeding. Even when the underlying causes isn't dangerous, every period can have another major consequence: iron deficiency and anemia. Repeated blood loss can gradually deplete your blood ions, so in many, you may become tired, dizzy, breathless with activity, experience headache, or notice your heart racing. That's why investigation and getting to talk to your doctor about every period isn't only about controlling the bleeding. We also need to check what the blood loss is doing to your body. Very heavy bleeding can sometimes require urgent assessment. Seek prompt medical help if you're bleeding extremely heavily, becoming faint or severely dizzy, unusual weak, or shortness of breath, or experiencing severe abdominal or pelvic pain. And if pregnancy is possible, significant vaginal bleeding needs appropriate medical assessment because the causes are different from an ordinary heavy period. So what will your doctor actually do? They'll ask you about your heavy periods, how long they last, whether they are painful or irregular, your medications, pregnancy possibility, and other symptoms. Blood count can look for anemia. Iron studies may be useful. Other blood tests are selected according to your history, something like a blood clot test. Depending on your symptoms, you may also need a pelvic ultrasound or further evaluation of the uterus. The investigation should be tailored to you. So here's the bottom line: every periods are common, but that doesn't mean you should simply suffer through them every month. The cause might be fibroid, adenomyosis, irregular ovulation, a bleeding disorder, medication, or another condition. And importantly, repeated heavy bleeding can lead to iron deficiency and anemia. If your periods are becoming heavier, lasting longer, interfering with your daily life, or leaving you exhausted, speak with a healthcare professional now. Your period can tell you something about your health, so do not ignore a major change in your normal pattern. I am Dr. Aminat. Follow Mina's mini vlog for simple evidence-based medical education, because knowledge saves life. Thank you.